In this second video, we're going to discuss peptide side effects and risks, okay, because there are risks to them. People think they're neutral, they're not neutral. Peptides are powerful tools. They are not risk-free, especially when used outside of clinical settings or at supraphysiological doses. In other words, they suggest a small amount to take, but if you're using greater than that, there is going to be greater side effects. Short and long-term effects can vary depending on the class of peptides. So let's categorize these and we'll talk about them. Okay, so growth-related peptides, so IGF-1, LR3, and DES. Short-term, hyperglycemia can mimic insulin and lower your blood glucose. Joint pain, okay, so they're obviously going to give more joint pain. Numbness and tingling in the feet and hands. This is like a carpal tunnel-like syndrome. And they also can increase your water retention, very similar to what steroids would do. So the long-term effects, potential tumor growth, stimulation if cancerous cells are present, and that's because they obviously prevent apoptosis. Insulin resistance, okay, so in other words, you can get greater insulin resistance from them. So that means that obviously you're going to have an inability to metabolize glucose, okay? Acromegaly, or acromegaly is basically you're going to have greater sort of distortion of the bones in your face, elbows, and so forth. Okay, so these, especially in extreme cases, so you can have larger facial bones, elbows grow, knees, and things like that, and it's going to stand out. It can be a very sort of bad effect that they can have on the size of your jaw and so forth. Now the GHRH, GHRPs, and ipamorelin. Short-term side effects, water retention, similarly to a lot of steroids and as we mentioned, our IGF-1s. Fatigue or lethargy due to hormone shifts. Increased appetite, especially GHRP6. Now some people take it for the appetite. That can have a benefit, but it can also have, obviously, compounding effects of putting on too much weight. Temporary dizziness or flushing. The long-term effects, elevated prolactin, okay, so elevated prolactin, greater estrogen, and in that case, greater, obviously, effects like you can have gynecomastia and so forth. Mild cortisone elevation, except for ipamorelin, okay, as already mentioned, which means that you're going to have lowered testosterone levels, because if your cortisol goes up, your testosterone goes down because they work along the same pathway. Desensitization or overuse in poorly cycled, so fingers and stuff, you're going to have problems with your peripheral nervous system. GH axis suppression, okay, you're going to have lower GH production because you're suppressing your GH. PEG MGF, okay, so that's the one that's actually involved in your satellite cell activation. You can have side inflammation or irritation, fatigue or malaise, in other words, you're just sort of like, you're not able to think correctly, nausea, which is rare but can happen. Long-term, risk of abnormal tissue growth, that's more theoretical, but due to IGF-1-like activity. Imbalance in localized muscle growth if site injected inconsistently, so muscles are growing weirdly in some areas, okay? Very limited human data, long-term effects are speculative, okay? We don't know enough about them, they're research chemicals, so guys, obviously if you're ever going to use these things, be really careful with them, okay? Myostatin inhibitors, okay, follistatin 344, short-term muscle cramping, nausea, appetite suppression, long-term effects, unknown long-term safety in humans, may disrupt muscle tendon balance, in other words, rapid muscle gain, but your tendons don't keep up, which can lead to, obviously, tendon injuries. Possible infertility or hormone imbalance. Activins also regulate reproductivity and endocrine functions. So if you're taking it for the long term, you can have problems with reproductive cells, and then obviously, if you want to have children, there can be a problem with that. Okay, Now we're going into BPC 157, healing regenerative peptides. Minimal side effects in most users, headaches or nausea, okay, dizziness. Now, long-term data in humans is extremely limited. The theoretical concerns, uncontrolled cell growth, especially with long-term high-dose use. Now, that cell proliferation can potentially cause tumor growth, okay, same as other growth hormone-releasing ones. Now, TB500 thymosin beta-4, injection site irritation, lethargy or lightheadedness, okay, temporary immune suppression, which can be rare, okay? No conclusive human studies, speculative risk, cancer progression if pre-existing malignancies exist. So if you're a person that's had cancers before or suspect cancers, don't take this, okay? This is due to angiogenesis promotion, okay? Now, peptides and side effects for cognitive nootropics, okay, so mild headaches or sleep disturbances, nasal irritation if used as a spray, okay, so it irritates your sinus passages. Generally safe in low doses, no seriously known side effects, very limited scale human data on these, okay. Sexual function peptides, nausea and vomiting, not very good if you obviously using it to increase your sexual function. Headache, flushing, increased blood pressure, because obviously they're going to promote greater blood flow to certain areas. They're also going to increase your blood pressure. Probably similar effects, but not quite as great as things like, obviously, your sexual functioning, things like Viagra and so forth. No well-documented long-term risks, tolerance possible with frequent use. In other words, if you get more tolerance, it doesn't have as good an effect, okay? But there's also, you tolerate it better, but that means that maybe it doesn't work for you as well. So your body becomes desensitized to it. The cosmetic skin peptides, GHKCU, matrixyl, and arginine, okay? Topical irritation or allergy, blue tint to skin, rare from copper overload. So copper can cause a blue tinge to your skin. No known systemic side effects when used topically. Minimal risk due to localized applications. So it's not really in your body, so you're not going to have a lot of bodily side effects. Okay, I put a actual sort of table on that so you guys can have a look at it and what it can actually do. So now there's regular testing that you need to do for these. So for the IGF-1s, you have to go and do your GH levels. You have to do things like fasting insulin and glucose because they can affect your blood glucose levels. You have to actually do your HbA1c because you may have higher blood glucose levels, in which case you're going to have the beginnings of insulin resistance and higher total blood sugar. And you have to do a comprehensive metabolic panel, liver and kidney markers, glucose, electrolytes, and general health because if you are affecting your insulin resistance, you're affecting your actual health, okay? Next up, we have hormone panels. So with the hormone panels, you do things like your free testosterone and your total testosterone. This is the GH-related peptides because they can lower it. LH and FSH, so if you have greater LH and FSH, then what you're going to have is obviously problems with estrogen production, okay, and IGF-1 levels as well, okay. Prolactin, similar thing. Estradiol, you've got to get that done, okay, so that's E2. And so these are with a lot of your growth hormone ones. And you've got to do your cortisol, so you do an AM cortisol test. I think it's a saliva test. Some can mildly increase cortisol, which is then going to lower your testosterone levels. Now, you've also got to do your lipid and cardiovascular panel. So lipid panels, so IGF-1 and GH can alter your lipid profiles. So you've got to make sure that obviously your cholesterol and your different lipids don't go up too much. Your CRP or C-reactive proteins, marker for systemic inflammation. So make sure that you're not getting massive inflammation, which can then lead to heart attacks. And your homocysteine, which is cardiovascular risk marker, elevated levels can be modified with B vitamins. But obviously we've got to watch these things, guys. It's very important that we watch our overall health if we're using something, especially performance enhancing. Now, cancer risk, cell proliferation, long-term users, so PSA, prostate-specific antigen, so if you're over 40, increased risk of problems with your prostate, so especially with IGF-1, which may promote prostate tissue growth. CEA, which is carcinoembryonic antigen. Okay, this is a general tumour marker, non-specific but useful for baseline screening. So if that goes up, you've got more chance of tumour growth. We don't want that. Complete blood count, so detects infections, immune abnormalities or possible blood cancers, but also obviously increased red blood cell count. LDH, lactate dehydrogenase, elevated in some cancers and tissue damaging states. And we want to obviously, this is not in everyone, but ultrasounds or MRIs, if any unexplained growth, swelling or tumour risk is suspected, we want to make sure that, we don't have cancers, okay? Now, miscellaneous for recovery peptides. So CMP, liver enzymes, check your liver health and peptide clearance, okay? Kidney function, so your BUN, your creatinine, and your GFR to monitor, obviously, if you're not having problems with your renal stress from peptide metabolism, and CBC to rule out immune or blood-related abnormalities, okay? So there's a lot of things you do have to check when you're obviously doing it, okay? And those are the things that obviously you want to make sure your health is good, so you've got to check them throughout if you're doing peptides, especially at an elevated level, okay?